My name's Jo and I'm a delegate at the Forensic and Analytical Science Services Laboratory located in Lidcombe. We've been operating for at least 120 years as a government analyst for New South Wales. In April of 2014, the food testing laboratories were called to a meeting where they were told that they were being deleted from the system. 17 people will be made redundant. Some of them spent their entire working life at FAS. We started a campaign. We had a 4-hour stop work out the front of the FAS facility. We wrote to the ministers, the Minister for Primary Industries, Trina Hodgkinson, and the Minister for Health, Gillian Skinner, requesting a meeting with them so we could discuss our concerns and to try and come up with a solution to keeping the labs here at FAS and in public hands. So there was no response for them. We decided it was time to take our fight to Parliament House. So again, we had another stop work. So we're not quite sure why this has happened. Doesn't really make sense because there's a service level agreement with the Food Authority, and that is not set to expire until July of 2015.
I can't believe that the government would act against the interests of public health, which is how I see this proposed closure.
I would be very concerned about the privatisation of this testing laboratory. I mean, clearly, standards that are set by governments have an independence about them.
My name's Alex Chapman. I'm a senior hospital scientist. I'm a union delegate of FAS. The closing of food testing will have a bad effect on the people of New South Wales. We have accountability to the government in terms of meeting this very high standard. We have been benchmarked against best practice in the food industry, and private labs will not be able to meet this same level. We're asked to develop methods quickly that are not standard methods that our client, the Food Authority, requires in terms of responses to food-borne disease outbreaks. The chemistry lab developed a method for cassava, cyanide testing cassava, the only lab in the country that has developed such a method. Virus testing in oysters, our particular laboratory developed that method. It's cutting edge and done by maybe one or two other labs in Australia. We put a lot of time and effort. We have a lot of checks and balances when samples come in, and so the accuracy and the quality is of a much higher standard. Now, an example of this is evidenced by a trial that our laboratory performed. We found a very high number of bacteria in a sample, whereas other labs within that trial found lower numbers. So that indicates to me that the standards are not as high as our laboratory, and that there's a possibility that private labs may be under-reporting and therefore missing important bacteria. So as part of the preventative strategies of New South Wales Health and the New South Wales Government, the laboratory provides services of such a high standard that helps to prevent food poisoning and the contamination of the food supply with toxic bacteria and chemicals, and this is now in danger.
I am a food analyst working in the General Chemistry Laboratory that's testing the food that's submitted by New South Wales Food Authority. And we are testing the preservatives, testing the toxins in oysters, and the histamine in fish and seafood. And all of a sudden, one day, we were told that we will be restructured, on the lab will be merged, and the people will go, a number of people will go. And then a year or two after that, the director just called us and say, that's it, the lab is closed. The food lab is closed, and nobody else, and 17 people will lose the job. Well, I am one of the 17 people that losing the job by the end of July. and it's really affected my life seriously. I was diagnosed with breast cancer last year and went through all the horrible chemo and radiation. I just picked myself up, and now facing losing the job is horrible. It's really terrible. It's really affect my life dramatically. I don't know how to start it, how to tell the kids, especially one that just first year in uni and she need a lot of support, and the little one even still in high school, but they need tutor and things like that. And once again, mommy's been sick for a year. She's just about to recover, and now she's facing another dilemma in her life. So I'm not sure whether I get any more support from kids, from my family and my husband as well.
If the public could get behind us, that would be really good. We have an online petition at change.org. If you go to change.org and type in "Stop Playing with New South Wales Health," you'll come across our petition. Also, see your local member. This is a huge mistake. This has the potential to affect all of New South Wales. If the government gets its way and we do close down, that will mean the privatisation of the food safety testing in New South Wales. That's a pretty scary prospect.